Okay, good afternoon. Still on that topic of hypoxic ischemic encephalopathy. It's a pity that sister that said, had it been she knew this, it's a pity, and I pray that affliction will not arise the second time. So I'm going to state in details how it happens, all right? Then what you should know, what you can do to prevent it, and if actually it occurs, what you are still going to do. I've seen us bury. This hypoxic ischemic encephalopathy I have explained is oxygen deprivation to the brain. Simply put, oxygen deprivation to the brain. Having classified it into three: stage one, stage two, and stage three, and then mention few things that can cause it is either coming prenatally, antenatal, during delivery and after delivery. That's during the time you are pregnant. If you are a woman, you are hypertensive, you are diabetic, you have one health challenge or the other, severe malaria in pregnancy, anemia in pregnancy. When I talk about these things, we are talking about severity. Yes, some pregnant women will suffer malaria, but that will be mild. But it's not even good for a pregnant woman to have malaria. That's why we give SP in each trimester according to how you should receive it. So you don't wait until you have malaria and then you will start talking about treatment. You may not know the severity, all right? Now, if you have diabetes prior to conception, then you shouldn't be too far from your hospital because that will predispose your baby to become excessively big. We call them macrosomic babies. When you have a macrosomic baby, they are the ones that they'll be facing, some challenges with their lives because they are excessively big. Most of you will not know, and then you will go to the quacks who will ask you to push. On attempt of pushing, the fetal head will get stuck. Either a labor will be prolonged, or there will be one complication or the other, and that will lead to this destruction of the brain cells. That child will come down with hypoxic ischemic encephalopathy. When you are pregnant and you are hypertensive, you shouldn't be far from hospital because your fetus needs to be taken care of as well as yourself. When you don't go to the hospital, you are doing self-medication or you are visiting quacks, you are risking your life and that of your fetus. And this may lead to the condition I just mentioned. When you are anemic during pregnancy, you are risking the life of your fetus and yourself. So a pregnant woman is not supposed to be too far from the hospital because you should be on check by your midwife or your doctor. Now that's during pregnancy. During delivery, I will always say I lay more emphasis on this because most times some people will end up in the hands of quacks. Yes. Prior to delivery, we do pelvic assessments. One of the indications for cesarean section is what we call cephalopelvic disproportion or cephalopelvic disproportion. If you don't have gynecoid pelvis, you have android, anthropoid, and all the rest of the pelvis, then you know you shouldn't go for vaginal delivery, except you have gynecoid pelvis. Gynecoid pelvis is the right pelvis for every woman to have a safe vaginal delivery. It doesn't mean there are no other indications. Even if you have adequate pelvis, there are other indications that will not warrant you to push the baby. These things are just to prevent, or we are trying to reduce the rate at which we are having these special needs children. So during delivery, as a second stage, that this HIE can occur. Having mentioned about 10 cm cervical dilatation, madam, if your cervix is full, your midwife will tell you. And that your cervix is full does not mean that you push out the head of your baby immediately. Yes, there are some things we do, we check. If the anterior lip of your cervix is not, off the fetal head, you are not supposed to push. When labor comes, when it is time to deliver, nature will make it that the pressure will become unbearable, and then you can push out with little effort. So you don't allow anybody to compel you to push when it is not time. Remember, when you start pushing earlier, you will have exhaustion, and then that fetus life will be at risk. So you follow instructions, ensure you don't do the things that can make or risk the life of this your fetus. All right. When the fetal head is engaged, don't allow anybody to tie anything on your that's the upper part of your abdomen, telling you that the head of your baby is still up. That means that person is not practicing it right. If cervix is dilated, it is dilated. If pelvis is adequate, is adequate. If your fetal weight is adequate for vaginal delivery, there is nothing that will change it at the time of delivery. So don't allow anybody to tie something on your waist and tell you to your baby is going up, madam, you have to keep pushing. No. And some people will go to the extent of having earlier induction of labor. Yes, they would like to induce labor. A patient shared the story with me that because the woman that wanted to conduct her delivery want to travel for a burial, the woman asked her to come, and then she was doing induction of labor in the wrong way, and then complication arose. The woman was referred to where I worked. Before their arrival, that fetus will have lost her. So you see those kind of things. When it is not time, please don't do it. And now you patient that is in labor, your midwife is telling you now you have to push. Please cooperate. You don't raise your bum bum. Me, I don't advise women to raise their bum bum during delivery. Just pin your bum bum on the couch, your buttocks, pin it on the couch. That will make it easier for you and then save you from some complications like tear. Pin your bum bum on the couch. We'll position you the way you should be and then tell you when to push, when to stop, and when to cough. If you watch my previous video where I was conducting delivery, you can just gaze from what I was saying. I was telling that woman, don't push, just cough. That was what I was telling her. The baby's head is out. So I was telling her, don't push, just cough. So we have time when you don't push, time when you should relax, and time when you should cough. So don't allow anybody to compel you to you push from the beginning to the end. Even when they want to deliver the placenta, they will tell you to push. These are the things that can make our fetal head to be stopped. You are asked to push. There is time to give a episiotomy. When it is time to give a episiotomy, your midwife should do that if she is skilled, if she knows the physiology of the labor and delivery. Your midwife will do that at the appropriate time with the amount that will accommodate the fetal head, that will be roomy for the baby's head to pass through. So you don't want to be given a episiotomy. You want to push out the head of the baby on your own. Madam, you are going to have lacerations, what you call tear. You are going to have excessive lacerations. So please, the head of that baby is so important that you should push it out when it is necessary. That you should not push when it is not necessary. If you are trying to push when it is not necessary, remember, this fetus is taking something from the placenta, and you are trying to obstruct the function of this placenta. Thereby you will reduce oxygen circulation to your baby's brain, and that will cause this hypoxic ischemic encephalopathy. Now during delivery too, your midwife has delivered that a baby, and the baby didn't cry so much that they want to do their mago, and then they will turn the baby's head upside down, begin to hit the baby, begin to shake the baby, begin to do one thing or the other. Yes, they want to make your baby cry. This can make stage 1 of HIE to get to stage 2. Yes, it can even make it to get to stage 3. It can worsen it. We don't turn babies upside down. We don't beat babies. We don't hit them. We have what we call resuscitation of a newborn. If you are not skilled, you cannot do it. So don't allow anybody to turn your baby's head upside down, start shaking and beating. Some will tell you that they gave injection. I don't know what they are giving, but all they are doing is to resuscitate your baby. Now, this lies in the hands of your midwife or whosoever that is conducting the delivery for you. We don't accept that. It is not proper. You can make a child with just stage 1 of HIE to migrate to stage 2 or stage 3, because those malpractices, those things they are doing can risk the life of this baby and expose them to either stage 2 or to stage 3 of this hypoxic ischemic encephalopathy. Now, after delivery, what happens? You have delivered your baby. Somebody will say, my baby was bright, my child was bright. Yes, I have seen one. It was when she had accident or after she fell sick, we started noticing she was dropping from her position in school. Yes, anytime the brain lacks oxygen, this problem will arise, especially children. I've said it can either come when you are pregnant, when you are delivering the child, or after you have delivered. Number one causes of this problem is when the child is allowed to run into convulsion. You have allowed your child to be having seizure. Recurrent attack of seizure, or what you call convulsion, will cause this child hypoxic ischemic encephalopathy. So don't say because my child was bright or my baby cried immediately at birth, that means I am free. Oh, nothing will happen to my baby. Remember that something can still happen. So you have to be conscious of all these things. Now, how do we manage this hypoxic ischemic encephalopathy? If that baby is born, maybe one thing led to the other and the child did not cry immediately at birth, the first thing is, don't cover the head of that baby. Don't cover. Do not cover the head of the baby. Yes, expose the head of the baby so that that child will be free from congestion. The brain is suffering, everywhere is hot. Just leave the head open for the mother. Then oxygen is needed. Oxygen is needed. It's just the two things. Then if there is something we call meconium aspiration syndrome, that will be treated. Madam, it is not left for you. It is for your doctors and your midwives to know if this child is requiring oxygen. Then mass will be treated. If there are other underlying problems, they will be treated. This is during immediately at birth. Resuscitation is required. We will resuscitate that baby. That one is for me and other professionals. Resuscitate the baby and ensure there is no further complication. Then after delivery, that's when it now concerns you as a mother. How will you prevent your child from having hypoxic ischemic encephalopathy? You must have thermometer at home. If you are a mother with children, please always ensure that you check your children's temperature before they sleep. While they are sleeping, you can wake up in the night to check their body temperature. While they are sleeping, you can check. Then once they are back from school, give them time, you check their temperature. Checking of temperature with thermometer will help you to know when the child's temperature is becoming abnormal from normal or when it is becoming subnormal. When the child's temperature rises 38, 39 and 40, the next thing that will accompany it is what? Convulsion. And once that child starts convulsing, what are you supposed to do? Please rush to a tap, get a tepid water, or if you have hot water in your home, make it to become warm, lukewarm. Let it become lukewarm. Use it to soak the baby. Rush that child to the hospital. Do not give the baby anything in the mouth to eat. Don't waste time. Don't give the child anything in the mouth if that child is convulsing already. If the temperature rises, soak that child inside the water. We don't prescribe medications. In the case of emergency, yes, you can give something to relieve it immediately, but please be pouring that child water. If the child is not vomiting, give the child something to drink, whether juice, cold water, or anything, not soda. Please give anything oral. Let the child be sipping it while you are on your way to the hospital. There is something we call tepisponging. Why I'm not going to talk about the tepisponging is that you may not know how to do it, but please ensure you are soaking that baby with water. Get water. Don't allow, it's not that you are cleaning the body. When you use your flannel, your hanky, or your towel on your baby's body, make sure that there are drips of water on the child's body while you are on your way to the hospital. Do not give anything, don't rub any oil on your child's body. If your child is running temperature, do not rub any oil, please. If you are rubbing oil, all you are doing is to just seal off these pores where there could be evaporation, and that child will get relief. Please don't rub oil on the child's body, because you may be, anointed oil or whatever. Please do not rub, just water. As you are doing this, you are on your way to the hospital. I am still Nurse Berry from New Life Clinic and Maternity. Please do well to follow my YouTube channel. I love you all.